Hi, and thank you for joining our virtual seminar with Dr. Mary Caldwell and physical therapist Chris Thum, who will discuss and demonstrate essential exercises for running, as well as tips to remain injury free and stay safe during the pandemic. Dr. Caldwell and Chris are live at VCU Health's Neuroscience, Orthopedic, and Wellness Center, also known as the Now Center in short form. My name is Sharni Smith, and I am a member of VCU Health's marketing team. Before we get started, I would like to first make note that we will hold all questions until the very end. So if you have any questions, please feel free to drop those in the comment section and we will address them during the Q&A. So joining us today, we have Dr. Mary Caldwell, a sports medicine and physical medicine and rehabilitation physician at VCU Health. Mary earned her medical degree at the Philadelphia College of Osteopathic Medicine and completed her internal medicine internship at the University of Maryland and her residency in physical medicine and rehabilitation at Northwestern University, followed by her fellowship at Georgetown University. Mary has worked with multiple professional teams, including the Joffrey Ballet, Washington Wizards, DC United, and the Washington Spirit. In addition, she has also covered multiple marathons, including the Chicago Marathon and Richmond Marathon. She is now the team physician for Longwood University and Sportable, a focus on adaptive sports. She is a prior NCAA Division I track and field middle distance runner and still is an avid runner herself. Hi, Dr. Caldwell.
Hi, Sharnice. Thanks for having me.
Of course. And then next, I'll introduce Chris Thone, is an orthopedic physical therapist who specializes in helping runners achieve their peak physical goals. Chris obtained his Doctor of Physical Therapy from the University of Southern California, and after graduating, he practiced PT in Hawaii, Seattle, Boston, and Richmond. He's been practicing in Richmond area since 2007, joining VCU Health in 2016. Chris performs 3D run analysis at the VCU Now Center in Short Pump. Chris is a runner and a triathlete. He has run marathons and participated in triathlons of all distances, including an Ironman. Hi, Chris. How are you?
Hey, how are you doing? Thank you for having me as well.
Of course. So, thank you both for joining us today, and I will now turn the show over to you, Dr. Caldwell.
Thanks so much, Sharnice. So welcome, everybody. Thank you for joining us. It's quite the introduction. I'm not sure I deserve it. I sound cooler, I think, on paper than I might be in person, but thanks. A lot of experience with sports medicine. I'm also a physical medicine and rehabilitation provider, meaning while I specialize especially in sports-related injuries and running, I'm also a specialist in amputee medicine, brain injuries, spinal cord injuries. So we kind of do a lot of things, and it's just really fortunate to be here at VCU Health. So today I specifically wanted to talk to you about safe running during times of COVID, how you can better prepare for your virtual race, which is what we're doing almost across the nation everywhere, the growth of running as an industry, and then common injuries that we can hopefully prevent if you catch a little tips from our talk today. So thanks again. So I'll get started. I wanted to start with by saying if you're a new runner, meaning you've trained for less than 3 months, or if you're more of a pro or a recreational runner, meaning you've got more than 3 months of running on your belt, I really think this talk can reach everyone. You know, we all get injuries no matter how long we've been training. So first I want to remind you that it's totally safe to run with a mask on. I know it might feel when you wear it that there's a little bit more increased workload, but we recommend that if you're running in groups, that you do so and be as safe as possible by wearing a mask. If you're running alone, you can absolutely not have your mask on, but if you come across people, you need to have a mask available so that you can put a mask on to keep yourself safe and protect and decrease the spread of COVID. So again, just a PSA on that. Okay, now into the fun part. So the growth of running. You know, running is one of the biggest sports worldwide. It's something that brings together runners from all over the nation and all over the world. It's a great thing, you know, that if you're a runner, you know there's just this energy that comes from running, this mental and physical well-being that you get overall that you just can't replace. We're a group of our own, I know. And so there's over 30 to 40 million runners worldwide, and the participation is still growing. You know, we have races all over, whether it be a 5K or it could be a 26.2 mile race, which we also call a marathon, as many of you know, and then ultra marathons, which is technically longer than that, and it can be anywhere from up to 50 miles or more. The average age of those running, and if you're out there thinking I'm too old to run, you're not too old to run. The average age of those running is actually 35 to 40 years of age. And in marathoners and ultra marathoners, the age is even older, up to about 40 to 45 years. So I never let people use age as an excuse, and I certainly won't let it apply to myself. As the expression goes, age definitely does not define you, and it won't in our clinic or at VCU Health. With regards to males and females, women are catching up with their participation rates, but women are still a little bit less involved with running than male counterparts. So women, we still got work to do. Switching gears to running injuries, because I really want to give Chris time to talk, because he's going to give you a lot of really good information on how you can prevent those injuries with some really good exercises, and he's the best at them. So really listen when he gets to those. On average, with regards to running injuries, anywhere from 19 or 20% to about 80% of runners will report a running-related injury at some time in their career. That's a big span of people that can have injury or risk to get an injury, and I understand that. It's a reminder that injuries are common and that you can't ignore something. If something feels wrong while you're running, you shouldn't ignore it. The definition of an injury is really important. An injury is really defined by the fact if it hampers or interrupts your training hours or your competition. So if something is preventing you from training or competing like you need to, that can be considered an injury and something we need to look at in more detail. In runners, factors commonly associated with an injury are typically a history of a prior injury, like a hamstring problem or an ankle problem or a shin problem, but especially poor training habits. So training without the appropriate buildup in the mileage is one of the most common things I see. It's really important to build up that tolerance and for the mileage that you're going to do. Further, 80% of those people that get injuries will continue to run despite the fact that their performance is suffering and their quality of their run is suffering. So that's one of the bigger reasons injuries can cause longer problems down the road, is if you ignore something and let it linger. Remember, running more miles and running them faster doesn't make you better. Everyone's body is different, and so if you have questions like that, those are things that we can talk to you about and work on. So let's go on to the most common injuries that we see. Number one thing I see in my clinic is knee-related injuries. It's typically a problem with how the kneecap tracks. So if the kneecap kind of tilts a little bit left or goes a little bit lateral or to the outside of the knee, that typically happens because the quad muscle is not strong enough or the butt muscle is not strong enough. And those are things that we really work to rehab that can prevent the most common runner-associated injury, which is that knee tracking syndrome, which we call patellofemoral pain syndrome. One of the most preventable things we can work on and a really common injury. The second most common group of injuries that we see outside of the knee would be the lower leg. So that shin area where you can get what's called shin splints, or you can get stress reactions, which means that the bone can actually start to suffer and can start to get weaker. And we don't want that to happen because that can actually take about 3 months to recover from, depending on how bad and how long that injury's persisted. So that's really important not to ignore shin pain. It could be a spectrum of problems that really needs to be looked at by a medical physician. Ankle overuse is the next most common group of problems, and that's usually a muscle issue or kind of an ankle range of motion issue, or the way that the foot lands. So it can be related to your running pattern. There's a lot of things that can be involved, but those are the most common things that we see. All athletes, most importantly, you need to listen to your body. Respect your body's other needs. Sleep is critical. If you're a runner, you know that by now. You didn't get a good night's sleep, your run's probably not going to feel great. Diet's also really, really important. One of the other common reasons I see both males and females is they just aren't taking in enough energy to match the amount of energy they're burning. That's actually called total energy expenditure, and this varies from person to person, depending on your body size, your genetics, meaning male or female, or your body composition and your overall activity level. It's a really relatively easy equation to work on, how much your body needs, and how much your body is burning. And we want to make sure is that you're not in a calorie deficit. We want to make sure you're taking in enough. Even though you might feel like you're eating a lot, you might not be eating the right group of foods or not enough fat or not enough protein. And that can be another reason that you get runner-related injuries. So if you have any questions of that, happy to see you in clinic and we can work on that together. I want to emphasize that if you're a runner or not, or if you're looking to start running and be as safe as you can, exercise for all persons for their entire body is important. Heart benefits, lung benefits, kidney benefits. It's important for your whole well-being. Exercise is really important to do at least 30 minutes 3 times a week at a pace where it's difficult to carry on a conversation. If you're not hitting that threshold, then there's a chance the exercise you're doing is not good enough quality to give you the overall health benefits. So if you have questions on that, happy to go through it with you, but it's really important that you're exercising at a good quality and for the right time frame and frequency. Lastly, and I know I already said lastly, but I've got one more thing. So I recommend that all runners really consider a yearly check-in. Both myself and my partner, Dr. Jack, have a lot of experience with running here. We're both happy to see you. Running over the age of 50 can come with some other things that we need to look at, such as the heart and making sure that the heart can take on the load that a marathon causes. And so there's other things that we think about when we see runners that can be very age dependent or person dependent. Having a certain family history of complications can also make it so that we need to work up certain things to make sure you're safe when you run and to help you do what you need to do. Okay, so given the most common injuries are typically overuse injuries, this is where I think Chris really comes in to help you prevent those. So I'm gonna go ahead and pass the mic on over to Chris Thone. He's just one of the most excellent physical therapists we have, and we're really lucky to have him. So off to you, Chris.
So today I'm going to talk about injury prevention and exercises that you can perform in order to avoid those common running injuries that Dr. Caldwell was talking about. And as Dr. Caldwell was talking about, running has experienced a lot of growth over the past decade. And it's likely due to accessibility. You can just grab your shoes and go right out the door and run right from your house, right? You don't need a team, you don't need a partner. You just right out the door and you can get that really great workout and feel good at the end of the day with that. The only thing that really is an expense with running is the shoes, and there's a lot of variables in shoes that are too much to go into today, so we won't worry about that. But there are some common mistakes that both novice and seasoned runners make as well. I think right now COVID-19 has brought about a few factors that can lead to problems. COVID has thrown off our usual routines. We're not in the gym as frequently as we used to be. We might be overtraining because there's not a whole lot to do. So let me just go outside and go for a run. And my 15 miles a week might now be 20, might be 25, might be 30, might be 40 plus. And now we got overtraining, overuse injuries, and we're starting to feel some of those kind of aches and pains in the legs at this point. And I think that increasing mileage alone isn't the only thing that's bad, but it needs to be balanced with strength training. All the current literature right now is discussing the fact that we need strength training in order to keep us healthy while we're running. And not only just doing strength training for kind of endurance, but really loading your system. So putting some weight and actually doing squats with weight as opposed to just air squats. Now, I don't want to throw up a huge amount of weight. I'm not a bodybuilder or anything like that. But what we just need to do is add some weight to our system. So even if it's a 10-pound kettlebell or a couple of dumbbells in your hands, that all adds some weight to your system when you're doing some of those strengthening exercises. So that's what we're going to kind of discuss. Most of these exercises I'll show you today are kind of without any needed props. You can do them right at home. You don't need to be at the gym. But if you at home, if you have some dumbbells, if you have paint cans, whatever you might have, that you can just add a little bit of weight to these exercises after you start to perfect some of the techniques. That's what we're looking at. And I think Dr. Caldwell talked about it. What we want to do is we want to hit the strength training. She talked about exercising, at least for 30 minutes, 3 times a week. I think if we can at least hit the strength training 2 to 3 times per week, minimum of 15 minutes spent on it, 30 minutes would be ideal. I think we'd all be a lot safer, a lot healthier as we increase our mileage, increase our pace, and try to really push our running skills at this point, okay? All right, so let's get on to some of the exercises that we're gonna do. The first couple that I'm gonna show you are gonna be on the ground. So everybody knows how to do a plank, but they're really important. And I'm going to show you just a couple of little variations that you can do to make them a little bit more kind of not only just involving your core, but involving your legs as well. Okay, so first one I'm going to do is just a regular plank here. So I'm going to get down on the ground here and just holding this position here. Now it can be for however long works for you. We can also add in hip extension. So we have that, hold that position. You can alternate to the other side there. And now we're kicking in the glutes a little bit more. Next one we're going to try is going to be doing a side plank. The side plank is one that I love to give to my runners because this one really can kick in that glute med, those hip abductors that are super important for maintaining a balanced pelvis when you are running. And every time we are hitting the ground, there's a lot of force, 2 to 3 times our body weight going through each leg. So we need those glutes to really be able to fire. So we might do a side plank here, and then if you can always start from knees if that's too tough, but then we can go to feet, and then we can add in a little bit of the leg up, arm up as well. So you're really working that lateral hip here on this one. Also, the supporting leg is working pretty hard too, which we really like. So that's a great exercise for kind of kicking in the hip abductors. Okay, next thing we're going to do, we are going to go to a bridge. Now, everybody's done a bridge in the past, but this is going to be a bridge with a little bit of an extended knee here. So we're going to try to kick in your hamstrings a little bit more. At that point, we can then march in one leg, and you'll feel your hamstrings and your glutes really firing on this one here. Nice and easy. You want to do all your exercises in a nice controlled, slow pace. All right. Try that one out. I think you guys will like that. I mean, it's going to be hard, but I think it's a great exercise to do here. Okay, so the next thing we're going to do a couple of exercises with our step here. So what I'm going to do here is we're going to start from the top here, and we're just going to kind of bring our lateral tap down with a little bit of hip abduction. Back up, down, out, back, up, down, out, back, up. So again, kicking in that lateral hip. Also, that stance leg is really working hard. Now, the nice thing is you can do this off your front steps. You can do this off a retaining wall in your neighborhood somewhere. Something nice and easy. Just want 6 inches. This is a 12-inch stool. You can do it off of a higher stool, whatever you might have that's available. That's what you want to kind of find. Make it easy. Find what's available at the house there. All right. So another one we want to try is our anterior tap down. So this one is really working on controlling. Every time we land, every time when we're running, we land, we have to slow ourselves down. So we need a lot of control at that quad, eccentric control at the quad. So trying to do a anterior tap down. Other side, same thing. You're trying to maintain a level pelvis. You don't have to touch the ground, but just coming down and working those legs a little bit there. All right. So another good way to kick in your glutes, kick in your quads, kind of work the legs is doing the step ups. So if I bring this up a little bit here, just kind of, and finding something that's high enough, but doing a step up, back down, step up, back down, really trying to work that leg here a little bit. And doing, you want to do enough reps to really make this feel like, you're having some fatigue. You can always bring the kettlebell into it as well. Step up, step up. Now you have to balance a weight on one side so that you're working a little bit more with the core and with kind of the glutes to maintain that good upright posture. All right. Another one that I like a lot, because I think it kicks in your glutes some, is the lateral step up. So kind of a similar activity, but I'm stepping up here, so I get my lateral hip working a little bit more, and you're coming up, down, up, down, up. You can even make it a little bit tougher. You can add a jump at the end, and you get a little bit more of a aerobic work right there. Okay, so another good one that I've been giving a lot of my patients recently, just because I think it really works a lot of the hip stabilizers, is stepping up, coming down with your heel, up, out with your toe, up, back, up, and around. So up, down with the heel, up, out with the toe, up, back, up, and around. Okay? Switch around, do the other side, same thing. So you get kind of that anterior tap down, you get that lateral tap, so you're working those hip abductors. You get into that extension, so you get a little bit of that hip flexor stretch as well. And the curtsy adds in just a little bit of that unstable ground. So, oh, I'm breathing hard here. Going through the exercises pretty quick here. So, okay, calf raises. So we all know how to do the calf raises up onto the toes, up onto the toes. That's great. So you're working the gastrocsoleus complex, but we also want to do the soleus muscle, which is the higher of the two, really works to, really has to work hard during running. So we also want to work that one. So getting into a little bit of a knee bend and coming up on the toes, up on the toes, up on the toes. That one will kick in your soleus. Another way to do it is, I think if we go down to the ground here one more time here, we can do a bridge on your toes. So a bridge on the toes, you're gonna kick in your hamstring, you're gonna kick in your soleus at that point. All right? Nice and easy there. So an RDL or a deadlift is great. Using a kettlebell on that one is great as well. So what we're gonna try to do here is, I'm gonna go at a little bit of an angle here, just kind of coming right down there, back here again, right down there. You can add in a little bit of the high knee, down, up, down, up. Yeah, on that exercise, I like that one a lot. That's big bang for your buck. You're working your hip, you're working your quad, hamstring, calf, balance. You know, people talk about their balance isn't great. Well, you need to have good balance if you're going to be running, right? So single leg support and really working all those muscles at the same time. I think the deadlift RDL is a really good exercise to do frequently. So, all right, so we're going to do a paddle off press here next. So this exercise is great for your core, all right? It's going to work all those rotators, which we need while we're running. So the nice thing is, if you get a band, and bands you can get at any sporting goods store, you can get them on Amazon. They're pretty readily available. You know, some weights have been not very available right now just due to COVID as well, but bands are pretty available. So you're going to come out there, you're going to get a little bit of into a ready position, and now my hips have to work. Then I'm going to push out. I'm going to hold for 5 seconds. Now my core is working because it's trying to prevent this band from pulling me this direction. So I'm working all this musculature to keep myself here straight in the center here. So it's a great exercise to do. Hold it for maybe 5 seconds, do 10 reps, flip around, do the other side. We always want to be balanced. Every exercise you should do on both sides, just to have that good balance, all right? If you experience some injury during the course of training and you're just not sure, am I ready to get back to running? And you may have not seen a doctor and you took a little bit of time off and you just want to see how your body responds to it. A great exercise to do is just pogo jumps. If you have a metronome, this is a metronome here. Everybody can get a metronome for free on their phone. What you want to set it to is 160 beats, and you're just going to try to match that. And really what you're trying to see is your body ready to start to absorb impact? Running is all about impact, right? Every time you run. So just getting that little constant beat there. So if we put the metronome on here, And we're just trying to, let me just get that turned up a little bit there. Just trying to match that. So it's real quick, getting off to the ground. If you have pain, you're probably not ready to get back to running. If that feels pretty comfortable, then you probably can go out there and start to maybe progress your running back up again, which is what we all want to do at this point. So, all right, so a couple of other good ones here. Marching. Marching's a great exercise. Gets in that single leg support, right? Running is a lot of single leg support. You have flight time during running, but you're also in one leg on the ground here. You can add a kettlebell, some kind of strengthening up above, but just marching across the room. You would always want to obviously flip to the other side and do the same thing with the other leg, with the other arm and leg, working your core. If you have a barbell, you can do both arms overhead. Mix it up. You know, adding a weight to one side of your body makes you have to provide that balance. Adding something overhead, it really encourages, you know, overhead upright posture. So we're not getting that slumped, rounded posture. We always want to think about our posture while we're doing our exercises so that we're not kind of rounding out and just basically cheating and using some of the joints as opposed to the muscles to work. Let's see here on my list. Oh, yes. All right. So we talked about the press here with some of those. Another way we can do some of these exercises, we can do single leg stance, and now all of a sudden we are forcing our system to work a little bit differently, working the core, working the leg at the same time here. Any angle you want to hit. If you do rows at the gym, you know, stand on one leg, do 10 reps, stand on the other leg, do 10 reps on that side. Use your bands at home. You know, these bands attaching to doors. I throw mine around my tree in the front yard and do it in the front yard that way. So, you know, you just got to make it work, make it easy. Try to get rid of the things that impede us from exercising. It's easy to find excuses. We got to find reasons to get out there and do it. So stretching, that's the last thing I want to discuss. So stretching, running is in a real mid-range activity. If you're sprinting, you're getting that full range of motion, and you might need to kind of expand those ends of your limits for your hip flexor or your hamstring or whatnot. In general, when we're doing long distance running, marathons, 10Ks, half marathons, it's real mid-range. So stretching is probably not as important in those situations. Now, where I think it really is important is if I feel something come on, if I feel like my calf is tightening up, if I feel like my hamstrings spasm on me sometimes or just are not working as well, that's when you want to stretch. I think it is being proactive. If you feel like something's going on there and stretching, and if it feels good, I'm never going to tell anybody not to stretch. I think stretching has a lot of benefits. It just feels good just to get those joints moving. It's probably not as important as the strengthening aspect. So if you only have a limited amount of time, most of us do, I want you to do some strengthening prior to doing any kind of stretching. That is more important to keeping you safe, healthy, and on the road during any kind of training season. So, you know, stretching, you know, we can find a lot of things online on how to stretch. If you feel something, you know, look online, see if you can stretch it a little bit. But, you know, really, if any of these nagging injuries last, go see Dr. Caldwell. Come see us in physical therapy. You know, our goal as a team is to get you on the road and running. We don't want to tell you, oh, you know what, running is bad for you. Running is not bad for you. Running poorly is bad for you. But in general, I think, you know, it doesn't cause arthritis. It has all these cardiovascular benefits. You know, just the most important thing in life is to move that body, right? And if you feel like that there's something kind of impeding that, come see the docs, come see the physical therapists. We will definitely get you moving. That's what we want. That's what we really encourage. All right. So thank you very much for watching these exercises. I think we're going to throw it over to the question and answers at this point.
Yeah, thank you so much. Thank you both for that. We will now open the floor for questions. So first, I will read some questions that were sent along beforehand, and then we will start answering questions from our Facebook viewers. So our first question we have, I run in the morning before heading to my desk job, but I'm tight when I stand up. What can I do?
Chris, you got this one.
Yeah, say that. Can you repeat it one more time?
Oh yeah, of course.
From the exercise.
It's okay. I run in the morning before heading to my desk job, but I'm tight when I stand up. What can I do?
Yeah, so moving frequently is important. I think look at it right now. Kids are sitting too long at computers. That's it. It's not good for adults. It's not good for kids. It's not good for anybody. You got to get up and move. Moving is important. That's going to help you get rid of some of that stiffness. But if you run in the morning, you're going to feel tight after doing that. You're working your body pretty hard at that point. So if you have to set an alarm, these watches that we have are great because you can set the 45-minute timer, you can set the 60-minute timer, and just have it repeat and get up and move around. That's a good time to, maybe I'll do just a little bit of stretches. I'm going to do the water cooler. I'll stretch my hip flexor when I go over there, or my hamstrings. I'll, just kind of do a little bit, some easy back bends or some bending forward. That is pretty normal. So I think that's when you want to just get your body moving some more to get rid of some of that tightness.
Okay, perfect. Thank you. The next question we have, I have heard of the concept of muscle confusion. Can you explain what this is and how I should incorporate this into my training?
So muscle confusion, right? So you're trying to, it's kind of like the cross-training aspect, right? So you don't, if you do the same activity every day, you're going to start to have much less benefit from it because your body's going to get real used to it. It's going to be kind of in a pattern, in a rhythm. What you need to do is try to mix things up. Train your muscles differently. Like those exercises that I was talking about, if you don't do the same 5 3 times a week, do this 5 one day, do this next 5 the second day, and do this other 5 the third day, or something like that. You want to get the body out of its just that kind of that stasis, that homeostasis that it wants to achieve. It just wants to revert to the lowest common denominator. You want to make it move. You want to make it do something different.
And if I may tag on to that, Shanice,
Yeah.
I think it's really important with what Chris is saying that cross training is really important. So, a lot of us that run all the time and have been running for most of our lives, we cross train. Not just with resistance training, but with swimming or with biking, soccer. We participate in other sports and we use those other muscles. And it actually really helps with your performance overall in each sport by cross-training those other muscles. So you may find that if you're not cross-training, you should.
Oh, that's awesome to hear. Thank you. So our next question, what's the best remedy for debilitating muscle soreness in the days after a hard session?
Go ahead, Dr. Caldwell.
I'll start with this one. If it's debilitating, I want you guys to make sure you've consulted with a doctor because there's delayed onset muscle soreness, right, which is an actual thing. And then there's actual medical conditions that can seriously hurt and the muscles can actually have damage. So if you're finding this pain is really severe every time you run, your urine might be changing color, like it's very dark when this is happening, please consult with us. And then I'll let Chris take on the average person who doesn't have a medical problem with it.
Yeah, and so if by debilitating we're just kind of saying, oh my gosh, I feel terrible, I feel like my muscles are achy,
Right.
that's more of the normal piece, right? So in that case, that's when we want to, if we have a massage stick, we want to roll out some of those muscles, or a foam roll. If you like that foam roll, just kind of get it moving a little bit there. One of the best things to do if I feel like I'm having all this muscle soreness after a hard session, go walk, get outside and, get a little pace going and just walk, just because, that you get the arms swinging, it gets a little bit of everything moving at that point. it doesn't have to be overly complicated. You got to make it nice and easy, something you can do right from home, quickly, easy, and just, like we talked about, get that body moving again.
Right. Okay. Perfect. And the next question, I have been having pain in my right glute. Are there any exercises or stretches that you can suggest for this?
Well, so a lot of those exercises that we talked about getting those glutes to fire and get them to
Right.
work, right? So, there can be some other reasons. There can be that, you have your pelvis is kind of misaligned, or it can be, that, your hip is getting a little bit of pinch and you're kind of just, that muscle is just not working. What I would try doing some of those exercises to get the muscles working first, stretches, the figure four piriformis stretch, just kind of taking the strap and doing a hamstring stretch, or, just try to see if you can move some things. But more importantly, let's try to fire up the muscles, because sometimes they're just not working. I think a lot of, I do 3D run analysis here at the Now Center, and what we find on these 3D run analysis is that those glutes are not doing what they're supposed to do. A lot of the anterior muscles are overworking, and we got to get the glutes to fire, because that's good. That's our big movers, our big stabilizers.
Right. Awesome. And the next question we have, if I'm experiencing pain while I run, how long should I wait before coming to see a physician?
Yeah, we don't want you to wait. So if you're having pain when you run and it's happened once, maybe you try again. But if it happens again and you can't get through your run, or you notice there's a pattern with it, we really want you to get evaluated. Remember, it's pushing through those pains that lead to longer term problems and more time away from the sport. So don't ignore it. Definitely come see us sooner than later.
Awesome. The next question, what does the 3D run analysis look at while I run, and what does it entail?
So we put markers on various joint positions, basically, in order to get good measurements of how the body's moving. We run you on a treadmill with a camera system above that will then kind of compute what your angles are, and it compares you to the average runner. So just because there's kind of just general motions that people should go through, and what it's looking for is real pieces that are just really far outside the norms. And then if they're outside the norms, why is that? Is that because of stiffness at joints? Is that because muscles aren't working? Is that because of, maybe it's a shoe issue as well? I think we take a look at everything from the pelvis to the foot and really try to figure out what's driving some of the aches and pains that you're experiencing.
Okay. Awesome. And that looks like all the questions that we have today. So thank you again, Dr. Caldwell and Chris. It was such a pleasure having you join us for this educational webinar. I'm glad that we were able to learn several important steps to properly prepare for a marathon and avoid injuries. So to learn more about VCU Health sports medicine, as well as physical medicine and rehabilitation, visit vcuhealth.org or follow at VCU Health on Facebook. Once again, thank you, Dr. Caldwell and Chris. And to all who joined us today, have a great day. Thank you.
Everybody.